I'd like to introduce you to our guests, Hesarnaee and Susan Chambers. Both are doctors in different parts of the world. Sharifa is a gynecologist at a government hospital in a private clinic, a 100-bed hospital in Kabul, Afghanistan, a hospital which was the site of a sickening attack in May on pregnant women, mothers, and their babies receiving care at the maternity ward. An unknown number of assailants stormed the maternity hospital and unleashed a series of explosions and gunfire that lasted for hours. 25 women and babies were systematically shot dead in the maternity ward. And in June, the International Medical Humanitarian Organization, Doctors Without Borders, announced its decision to end activities and withdraw from the hospital. Her mentor, Susan Chambers, was, I'm sure, horrified and worried about her good friend. Susan is also a doctor of obstetrics and gynecology, and along with two other female doctors, established a private practice together as the first only female OBGYN physician group in the area. She is now chief of staff at Lakeside Women's Hospital, which is owned by Integris. Susan has been a long-time mentor and is on the board of directors for IEEW. And all this amid COVID-19. Sharifa, you're barely back at work after the attack. With 3 children at home, it must have been a big decision to go back into that hospital. Tell us what it's like now between the attack and the COVID worries.
40 days after the attack, the hospital reopened, but it is not the same as before equipped, and it doesn't have possibilities the same as before. A cold condition is existing in this hospital because only MOPH staff are working now. Before, there were 360 staff on behalf of MSF, and we were treated every kind of patients, like high-risk patients, complicated patients. But now we cannot admit such patients, and it is mentionable that patients, because of standard health services, they even planned to organize their termination of pregnancies in this hospital in advance. And from remote areas, even rich people, they plan to come in this hospital to terminate their pregnancies. We can only admit and treat normal patients because MSF just support like some materials and some drugs, and they have promised that they will hand over all the other equipments to MPH, but they have not done it yet. Also, before there were an isolated area to treat and diagnose COVID-19 patients who were suspected or who were positive. And then they were admitted if they were in emergency conditions. Otherwise, they were referring to the specific health center, which was specified on behalf of MOPH. It was a maternity center from each other governmental hospital. The patients who were suspected or who were COVID-19 positive, they were referred to this hospital, and then they were treated and admitted. But now it is not the same as before. We don't have such an isolated area for the COVID-19 patients, and we treat the patients, normal patients, and even if the normal patients they are suspected or they are positive, we can admit the patient because the Ministry of Public Health announced that everywhere the suspected and COVID-19 positive should be treated.
Sharifa, as head of the OBGYN department in the hospital, how are you taking care of yourself when you have so many others to take care of?
It is very difficult to go back to the hospital. Really, it was a big decision, and I have so many businesses. I'm very busy, but let me tell you that my interest and my commitment to my profession and my passion to my profession does not let me stay home in one hand. On the other hand, the residents of this area are the most needy people, which also makes me to go back to my work, to continue to my work. And also, I all the time, when it is too much to do, I organize, I arrange, and I prioritize my works. And let me tell you that I enjoy to be tired of working, not to be tired of job business.
The internet reception is difficult between Afghanistan and the United States. So we ended up texting Sharifa, and then Susan is letting us know what she said.
I can tell you this woman's dynamite, so I'm sure she's doing it right, because she's awesome.
So ask her what she sees as the biggest problem for Afghanistan now and in the future.
I do remember one time, it wasn't Sharifa, but it was somebody else who said, and this is not a political statement at all, but they were really upset when the troops were withdrawn, because when the United Nations, or whatever it's called, forces were there, they felt much safer. And when they started to withdraw them, the anxiety of the whole country went up.
Well, in the people I've interviewed, they're very worried that the Taliban will return, and it sounds like now not only is the Taliban kind of present, I don't know how present, but in addition, there is another terrorist group that they are afraid of that is almost as bad.
Right. She mentioned that to me as well, yeah. Well, she said security is the biggest problem, but she said Afghanistan has difficulty in every aspect of the country. They have so many problems, but I do think she's right, at least from my friends in Afghanistan, that until you can have security, it's going to be hard to fix the rest of it. If you aren't secure, then you can't get help with IT or hospitals or wherever else you've been asking for help. And unless the country is secure, I think, that's just not going to work very well.
Let's ask one question of both of you.
Okay.
And one last question. And that is, what have you learned is the most important thing in your life?
Well, I think always the most important thing in my life has been my faith. Faith, family, friends, that's that kind of old saying, God first, family next, friends next. I mean, it's still the same for me. These COVID times, at least for me personally, have made me more thoughtful about all three of those things, to try to don't sweat the small stuff, be more forgiving, be more caring, be more neighborly. I mean, those are all things that I think I've always focused on, but I think the severity of these times have made me go, well, you just need to focus on the stuff that's really important, and the rest of it will fall in place. So I hope I've just become a more thoughtful, insightful person in all three of those areas. And, I would say faith, family, friends, you know, in that friend group and all of that is, I'm applying that to my personal life and to my professional life so that I continue to take good care of patients and try to be understanding of everybody's different needs and different situations and how this stress, life stresses, whether it's COVID or not, you know, affects people different ways, and then they express that in different ways. So you kind of have to be more, you have to listen more, be a little bit more understanding, try to get down to what's really going on with patients. So let's see, Sharifa answered back. She said, I think she means during these times that she's learned to be strong and move according to the time. I think she means, you know, be strong and courageous and adaptable to the times. I think they have to adapt all the time, but I think this cemented that for her, that they have to really be adaptable to the times because we're all in uncertain times. They're in wildly uncertain times. She also said that other things she learned is to be passionate and committed. So that's not a surprise.
Not a surprise. I think she's been that all along.
I do too, for sure. Yeah.
Well, thank you much. Thank you. Thank her if you came through your text, and thank you. We really appreciate you taking the time to do this because it gives us a different view of what's happening in the medical world that we just don't participate in every day.
Yeah.
So thank you.
You're welcome. My pleasure.